This is skill number 18, catheter care. I'm going to begin by knocking, pausing, and entering. Hi, Miss Jones. My name is Ann, and I'm going to be cleaning your catheter today. I always have my students go through their pre- and post-procedure actions for each skill, and that way they don't forget little steps. If they do it every time, it will help them, and so it will help you as well. If you always do the pre-procedure and post-procedure, it will help you to pass this test. So do the same thing before every time. I'm going to show you again. Knock, pause, enter. Hello, Miss Jones. My name is Ann, and I'm going to be cleaning your catheter today. Then I have them do peanut butter sandwich before and after every skill. And that is provide privacy, peanut. Bed is low and locked. We're going to check that by shaking it, by touching our button in order to lower the bed. Peanut, butter, sand, signal device. Of course, they don't need it at the beginning, but it's just a habit and it helps. Which wash hands. Now I'm ready to begin catheter care. So, Miss Jones, will you feel the water and let me know how it feels? She says it's good. I've already felt the water. I'm going to put a bed protector underneath her. Okay, I'm going to roll you on your side, Miss Jones, and slide a bed protector underneath the VUE. Always keeping your client covered. And remember, if at any time you make a small error or anything, or a large error, correct yourself. Your nurse evaluator will give you credit for that step if you remember and correct yourself while you're still on the same skill. So I put the bed protector under her. I'm going to apply my gloves before washing the catheter. As long as you put them on before washing the catheter, that is how that step is judged. I could have put them on as soon as I came in, or I could put them on right now. Okay, I'm going to expose the perineal area, keeping the rest of her body covered as much as possible. I do that by using my sheet like this. I'm going to uncover her leg a little bit so the camera can see, but you want to keep this leg covered as well while you're doing the skill. So I'm going to wet my wash rag. I'm going to apply soap to the wet wash rag. Now, this is your critical step. Holding the catheter at the meatus without tugging, you're going to wash the catheter moving only in one direction, moving away from meatus, using a clean area of the washcloth for each stroke. So I'm going to turn my washcloth over, and I'm going to do it again. Clean the catheter, moving away from meatus. I have my students clean the catheter 3 times, but as long as you do it twice, you've shown that you've used a different area of the washcloth for each stroke, that is sufficient. Okay, I'm done with my washing rag. I'm going to use my rinsing washcloth now. And it is the same step. It is also critical. You're going to hold the catheter at meatus and wash the catheter moving away from meatus, cleaning at least 4 inches away from the meatus, using a clean area of the wash rag for each stroke. Now I'm going to dry it. Again, we're holding the catheter and we're drying at least 4 inches, moving away from meatus. So if you dry it twice, make sure you change your spot on your towel. You do not have to dry it twice. All right, now we're going to remove our bed protector as we're finished with the washing part of the skill. I'm going to turn my mannequin over and pull out my bed protector. Remember, always hold linen away from your body, clean or dirty. And I'm going to put it in my designated dirty sold linen container. Now I'm ready to conclude the skill. And what I will do is take my basin over to the sink area, and I'm going to empty, rinse, and dry my basin. I'll be out of camera view briefly as I empty, rinse, and dry my basin. I'm emptying it, rinsing it, and drying it. I'm placing it in the designated dirty supply area. Remember on these skills that anytime you use a basin, you empty it, you rinse it, and you dry it. Now I'm going to remove my gloves now that I've already gotten rid of my linen, and I've emptied, rinsed, and dried my basin. Remove my gloves into the waste container and wash hands. Now I'm ready to finish my skill. I come back to my patient and I do my peanut butter sandwich. So now at the end I'm going to do remove privacy, peanut, bed low and locked. I shake it. I touch my button down here to make sure it's low. And sand. Here you go, Miss Jones. Here's your signal device. And which wash hands. That concludes skill number 18, catheter care.